My name is Lorna Butler, and I'm Dean in the College of Nursing here at the University of Saskatchewan. And I also have an appointment in the International Centre for Northern Governance and Development as the coordinator for the strategic arm of health and social well-being for the North. The work that the College of Nursing is doing in the North is that we were offered an opportunity by the Northern communities to assist them with workforce planning, particularly in relation to registered nurses. So we were able to introduce a technological program or equipment that's referred to as remote presence telementoring or telerobotics. The remote presence was developed to provide acute care services, particularly for individuals who have a stroke, particularly in rural areas where there's a certain amount of time required to provide treatment or the damage that's done is not reversible. Remote presence has what's called peripherals. So you can attach different devices to the back of the robot, which allows the communication from the remote site to the where the physician or nurse or healthcare provider happens to be. So the main use of it right now is to do visual assessments for individuals who've had a stroke, to do that neurological assessment, which is seeing them visually and having them do certain exercises or physical procedures. So that's been the main use. But by attaching these peripherals, you can do eye assessments, as I mentioned before. You can examine the ears, you can listen to the heart. There is a device that attaches which one of the physicians is using, which is an ultrasound. So let's say, for instance, there has been an accident on the side of the road. Maybe a woman was pregnant. You can actually do the ultrasound right there. Or in our remote communities, not every hospital has perhaps an ultrasound. Or certainly in community outreach clinics, as we go further north, there's not an ultrasound. So through the remote presence, there could be. The program in terms of remote presence is a College of Nursing initiative, and we partner with the communities. And the reason for that is that when that robot is not in class, we want it to be used for service delivery. We do not think that a child should have to come to Saskatoon for oral care when we can take the oral care to them, or to come to Saskatoon, which is 5.5 hours drive, for a short-term appointment with a specialist. Or if it's a diabetic education clinic, we can take the diabetic teacher to the north. So we partner with the community to help them have ownership of the robot that's there. So what I try to instill with the communities is it shouldn't be about the College of Nursing or the robot. It should be about what that robot can do for your community because it's there, and what do you need it for, and what would it facilitate. I think the advances in using this technology are limitless, but they are limited by your imagination. So we could say we've done this and that's all we're going to do, or we could look at opportunities. Where are there issues that right now healthcare or access to healthcare is a concern? So a project that we're working on now is looking at high absenteeism in the mines. So is there an opportunity to use remote presence to provide that care to the people in the mines so that they're not coming out for care, or we're able to deal with perhaps there are mental health issues that are there. And also on the nursing side, those nurses are isolated in those communities. Through remote presence, we can connect them to their peers in Saskatoon and have that two-way consultation to support the nurses' work that's there. So that's why I say that you're limited by your ability to think differently, to be willing to take a risk, and to push boundaries. And by pushing those boundaries, you have to ensure that the policies get developed that allow you to do what you need to do. It's difficult to take a robot into an area that doesn't have bandwidth or cellular coverage. Well, where do we not have cellular coverage? So it just depends on which robot you choose to use. But some of the value added in the northern communities by taking the robots there has been to increase their bandwidth, to increase the opportunity for a community to have access to connectivity, which is not anything to do with nursing, but because nursing was there, those connectivity issues have changed. It has increased human resources to provide for that, and all across their IT services were being provided by North Battleford. That's hours away. That makes no sense. Now having that in place has added to their human resources to support their hospital, not just the nursing program. So there are advantages in many ways.